Hi there. I am Dr. Quiet. It's nice to meet you today. Are you feeling alright? That's good, that's good. Alright, I can see here that you have been having severe headaches. Are these every day? No, just about how often? Twice a week? Okay. So twice a week, like every week? Alright. And on a scale from 1 to 10, what would you say the pain on those headaches are? Alright, so on a scale of 1 to 10, you would say that when you have the headaches, you're around an 8. Yeah, that's pretty high. That's pretty high for just a headache, and for that to be happening every week, it must be interfering with your life, I would imagine. So it says here that you have already gone to see your family doctor, and what did they think it was? Migraines. And did they recommend any medication for you? Imitrex. And did the Imitrex work? Right. That's interesting. A lot of patients I've heard have had really good reactions to the Imitrex. It just doesn't work like it used to. Well, how many months were you taking Imitrex on a weekly basis before it stopped working? Right. Right. I wouldn't think that that would be enough time for you to build up a tolerance to the Imitrex. Even though you're taking it every week, it shouldn't stop working after just a month. And were there any other medications that you tried? Okay. So no other medication helped at all. The only one that helped was Imitrex, and then it stopped working. Right? I'm just trying to be clear. Well, I think your doctor did the right thing by sending you in to have a cranial nerve examination. If there is something else going on and it's not just a headache, not just a migraine, this hopefully will help us figure out the problem. Right. Okay, so before we get started, I just want to let you know that this test is very easy. It should not cause you any pain. It shouldn't be too uncomfortable in any way. If at any time during the cranial nerve examination you have pain or discomfort that goes beyond just regular pressure, I need you to let me know so that I can stop and we can address the issue, okay? Right. Also, in this examination, I'm required to get very close to the patient. I'm going to be examining your eyes and your nose, your mouth. And for me to do that, I'm going to need to be in your space. Is that okay? Good. Well, I'm glad that you trust me. Okay. I'm just going to pull up your file here on the laptop. We try to keep written records, and we also try to keep digital records. I think having both is a good practice. I forgot to ask before about the other prescriptions for your headaches. Since the other prescriptions didn't work and the Amitrex stopped working, have you started to or continued to take Advil or ibuprofen, naproxen, anything like that? Okay. Alright. So at first you were trying like Tylenol, various acetaminophen. Okay. And how about the naproxen? Okay, so before you were diagnosed migraines, you were taking the naproxen. Got it. But you stopped all of those after... Okay, after you were given prescriptions, okay. How are you feeling right now? Do you have a headache now? Okay. Alright, that's good. Glad to hear that. When was your most recent headache? 2 days ago? And did that fit in with your 2 migraines a week schedule? Okay, so it's the first one this week? Alright. Alright, well today's what now? Tuesday? Okay, Tuesday. Well, it's yeah, it's still early in the week. Okay, so I just have a few more questions before I get started with the exam. Okay, so when you are not having any headaches, how is your vision? Right, I understand that you wear glasses, but with your glasses on and all your corrective lenses on, how is your vision? Good. No blurriness or anything like that? How about when you're experiencing a headache or a migraine? Gets a little bit blurry? Sensitivity to light? Okay, yeah. Yeah, sensitivity to light is a really common side effect when it comes to migraines. How bad is the blurred vision when you're experiencing your headaches? Would you be able to drive safely, you think? No? Okay, that's pretty serious. Oh, you get dizzy? Okay, so you think if you weren't so dizzy, you probably would be able to drive with the blurred vision? Not that I would recommend it, I'm just trying to get an idea of how bad it is. Okay. Right. Okay. Okay. So, how about your sense of smell? Normal? Both with and without headaches? Okay. You haven't noticed any difference smelling things you don't normally smell, or absence of smell, strengthened or weakened? Nothing at all? Completely the same? Alright, good. And how about your taste? Okay, So you know that when you aren't having headaches that your taste is fine. So you don't ever eat much when you're experiencing a migraine at all? Yeah, it's okay. I understand. It probably would be good though if you would eat, because if you're having a headache all day long, you should still eat, even if you are feeling a bit nauseous. Speaking of the nausea, is the nausea being caused by the dizziness, or does the nausea come on with the pain? Okay. Alright, so as long as you're lying down when you're experiencing these migraines, you do have blurred vision, but you don't experience dizziness, and then you won't experience the nausea. Okay. Alright, I've got it. So it's migraine, which causes the blurred vision, and then if you move, you get dizziness, which then causes you to be nauseous. Alright, wow. Yeah, that sounds pretty serious. I really hope that we can help you figure out what's going on, okay? Yeah. No, we'll keep trying. If we don't find something, I will be able to refer you somewhere, and we can figure out what's causing so much pain, okay? Right. Okay. At first it really does sound like a regular migraine, but what's really interesting about this case is that your Imitrex stopped working, and that might point to something else being the problem. Maybe the headaches or migraines are a symptom of something else going on. Okay. I'm going to ask you to cover up one eye. Your left eye first. That'll be good. And I'm going to show you this eye chart. Can you see that okay? The top line? Alright. Okay. I'm sure you can read this one, right? Since you don't have a headache. Okay, yep. G. W. B. G. S. B. E. You're doing good. 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 It's getting a little difficult. That's okay. Keep trying. Right. You're doing good. 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 That's right. Yes. This is actually an S. Okay. It's fine. Alright. Okay, so you're having a lot of trouble on this line here. Okay. Now, I want you to uncover this eye. I want you to cover up your right eye now. I'm going to show you the same thing, but this time we're going to start on the third line, since I know that you're doing just fine on the top two lines. And we're going to start right here. You see that all right? Good. 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 Good, good. You're not going by memory, are you? Maybe a little bit. That's okay. Oh, you must have a lot better vision in that eye. Okay, so you can't see this line at all? Can't even try. Okay, that's fine. Alright, I'm going to update your chart now. Okay, now I am going to test your peripheral vision. Your peripheral vision is just the vision from each side of your eye instead of direct on. Now, I want you to look right here, and I don't want you to look away from the tip of my nose. Just to keep your vision right here. No matter where my hands are going, I want your eyes right here. And I'm going to be coming in from either side with my fingers. I'm going to be wiggling them like this. And I just want you to let me know when you see my fingers come into your line of vision. But remember, keep looking at my nose, okay? Alright. Good. Good. Okay. Okay. Good. Good. Okay. You did very good. You have excellent peripheral vision. It would be interesting to do this test when you did have a migraine, but I'm not sure that you'd be able to get here considering all the adverse side effects. Alright, now I need you to cover up your left eye again. Okay. And I'm going to do that test once again, the peripheral vision test. It's just that you're going to have one of your eyes covered while I'm doing it, okay? So keep it covered. Good. 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 Alright, now, same thing. I just want you to cover up your right eye now. Just like this. Okay. 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 Good. Good job. See, it's easy, right? No problem. Even with one eye covered up, your peripheral vision is still great. Alright, now I'm going to be testing you for your blind spot. Everyone has this. That doesn't mean that there's a problem. We're just testing where your blind spot is and making sure it's in a normal spot, okay? I'm going to use this highlighter. Alright. Can you tell me what color this is? Blue. That's right. Okay. Now, I would like you to cover up your left eye again. just like this. And I'm going to move this, and I want you to tell me when it disappears and then when it reappears. All right. Keep staring right here. Okay. 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 All right. Seems normal on that side. Now, same thing. Cover up your right eye again, just like that. And keep staring at my nose. Okay. 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 All right. Good. Good job. You did very well. All right. Next, I need to test your pupils. And I'm going to be using my flashlight for this. This is probably going to be the most uncomfortable part of this test. Again, it shouldn't hurt, but it is a bright light, and I am going to have to shine it directly into your eyes. So it might get a little bit uncomfortable, but I'm just going to ask that you do your very best to keep your eyes as open as you can and not blink too much, okay? Alright, great. Alright, I'm also going to be getting into your personal space a bit for this. I'm going to start from normal distance, and then I'm going to move in closer and closer. Right, first, I would like you to follow the light. So wherever the light goes, I want your eyes to go. But keep your head facing forward towards me. Only move your eyes. Do this just a little bit closer. Keep following that light. Keep your face towards me. There seems to be a little bit of lag in one of your eyes. That's very interesting. So I'm just going to get a little bit closer, doing the same test. I'm going to see if I can just see what's going on here. This light is going to be pretty bright. Keep looking at me, following that light. I'm just looking in your eyes as you move your pupils. Okay. I'm going to make a quick note of that because that's probably an important finding. And normally this doesn't come till later in the exam, but I'm going to go ahead. I need to touch your face, so I'm going to move this up here around. I'm just going to come in and move your eye around a bit, the one that's lacking. I'm going to get close again, but with the light, and see if I can look at the back of your eye, see if I see anything then. Okay? Alright. It might not be anything to worry about, but something we should definitely check out. Alright, now I'm going to test your depth of field. Okay. I want you to look in the distance. I want you to look over my shoulder at the wall back there. And I bring my finger in. Keep looking at the wall back there. Now look at my finger. Okay, now look back at the wall. And look at my finger. Okay, back at the wall. Now back at my finger. Alright, that looks good. Alright, now I'm going to do what I said just a second ago. I'm going to be looking at the backs of your eyes. I have to get in very, very close to do this. Just want to warn you before I get right up on you. Alright. Now I'm going to, since I'm so up close, I'm going to bring in the light from the side so that it doesn't blind you immediately. Let you rest that eye for just a second, and then we're going to do the next eye. You ready? Alright. Just the same thing as before. Did see a little something back there. Not really sure what it is. I'll be scheduling you an appointment after this to look at that a little closer, okay? Yeah, we're gonna have to look at that with some bigger machines than my little flashlight. Okay, don't worry. Like I said before, we find anomalies in the human body all the time. They don't always mean anything. Then again, maybe it will mean something, and then we can get on to fixing you. Alright. Finish up with the light close to your eyes. Okay. For this test, I want you to focus on the light. Alright, watch the light. Okay. Now, I want you to follow my finger, and the light is going to stay right here. Good. Good job. this one shouldn't be uncomfortable at all. I'm done with the flashlight for a while. This one seems really similar to some of the tests we did before. Need you to look at my nose. Okay. Now, when you see my finger enter your field of vision, you need to start following the finger, okay? Good. 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 Okay. Now, I want you to stay looking at my nose. My finger is going to leave your field of vision, but keep looking at my nose and let me know when you cannot see my finger anymore. Good. All right. All right. Now, hopefully my nose isn't hideous to you because you're going to be looking at it a lot. I want you to look at my nose one more time, and now I just want you to look in whatever direction I tell you, and your head needs to stay right in front of me, but your eyes will move, okay? Alright. Look up. Look down. Back to the nose. Look right. Oh, sorry. My right. Look left. Good. Up. Good. Very good. Good job. Alright, now I am going to be testing the muscles in your face. I'm going to make some funny faces at you, and you need to just repeat those funny faces right back at me. You think you can do that? Alright, great. Alright, I want you to lift your eyebrows. Good. Alright, now screw up your eyes really tight, really tight, really tight. Okay, now keep them screwed up really tight, and I'm going to try to open them. Good, very strong. Alright, now I want you to puff out your cheeks. Okay, keep them puffed out. I'm going to try and push those in, and you just keep trying to keep them puffed out. Very nice. Alright, now clench your teeth. Got it. Alright, good job. Okay, now clench your teeth one more time. I'm gonna feel those muscles. Alright, feels good. Alright, now I need you to open your mouth. Keep your tongue in. I'm going to try and close your mouth. You try to keep it open. Very nice. You're very strong. Okay. Now I am going to touch. There are 3 base sites on your face, on your forehead, on your cheek here, and on your chin here. And I'm going to touch each of those spaces on either side of your face with my finger. And I want you to tell me if either of those feel differently on either side, if you cannot feel them, or if it hurts when I touch it, okay? I'm going to start up here. How's that? You're able to feel both of them, and they both felt the same? Good. Alright, here. How's that? Same again. Good. Alright, good. Okay, now I'm going to do a little more with those base sites. Those are, that's an important part of this test. I'm going to take this Q-tip here. I'm going to snap it in half. So essentially we have a rough side and a soft side. It shouldn't hurt. See, I'm able to scratch myself with it, no pain, but I can tell that it's rough and that is soft. Now, I'm going to touch one of those 3 spaces on either side of your face with either the soft side, the Q-tip, or the rough side. I need you to tell me if it is rough or soft and where I'm touching you on your face, okay? All right. Soft. Rough. Good. Rough. Good. Good. Soft, yeah, that's right. Soft. Soft. Good job. Good. I'm gonna dispose of these Q-tips. Alright, same test, except this time there's no rough, there's only soft. And I'm just going to tear out just the finest little wisp. And this is to test your sensitivity. Before, the soft side was still fairly blunt. Now it's going to be much more wispy, much less for you to feel. Alright, I need you don't have to tell me where I'm touching you, I just need you to tell me when I'm touching you. Good. 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 Can you feel that? Not really. Okay. But you were able to feel it very well there with the Q-tip, right? Okay. Alright, I'm just gonna keep touching you. I'm gonna get closer and closer with it, and I'm gonna figure out when you can feel it. You can't feel this, so I'm gonna see if you can feel this and then this. Just tell me when you feel it. Alright then. Okay. Alright. Well, it seems like a lot of your problems are in your right eye. That is interesting. Alright, well, it doesn't seem like you're having any problems with your mouth or your sense of smell, but it is standard practice in a cranial nerve examination to check those areas out anyway, because sometimes things can be connected and there's just no way to know until you test it. Is that alright? Is that okay with you? Okay. You're a very good patient. A very patient patient. Alright, I'm going to start with your mouth. Alright, I want you to open your mouth. Say ah. Stick your tongue out. Good. Open up. Say ah. Good. Good. Okay. Don't get tired on me. Keep that mouth open. Good. Alright. Alright, you did good. I didn't see anything. I didn't see anything abnormal in there. Your tongue looks fine, good in color. Everything's colored the right way. Your teeth look good. I'm not going to focus on your mouth too much since I'm pretty sure that the problem is closer to your eyes. Okay. And same goes for your nose. But again, it's just standard practice to test those out. I have 3 scents here in these bottles. And I'm going to open the lid and you're going to smell it. You can close your eyes if you'd like, but it doesn't matter too much since they aren't labeled. And I just want you to tell me what you smell, okay? What do you smell? Vanilla. That's right. Okay, next one. Okay, can you tell me what you smelled? Lemon, that's right. You're good at this game. And this is the last one. You're doing just fine. Doesn't seem like there's any problem with your nose, just as I suspected. Alright, what do you smell? Cinnamon. Yep. 3 out of 3. Alright, now I tested the muscles in your face earlier. I'm going to go over those one more time. It's part of the mouth part of it, but I don't need to go inside your mouth anymore. Alright, puff out your cheeks again. Just like that. Okay, now one at a time. Good. Alright, just like before, I'm going to try and push your cheek puffs in, but one at a time. Just do one. Okay. Good. Now the other one. Good job. Alright, now I need you to shrug your shoulders, just like this. I'm going to try and push those down. Ah, good. Good job. Alright, put your arms up like this. I'm going to try and pull them away from you. Ah, good job. All of your muscles seem to be very strong. I want you to look this way, and I'm going to try and push you this way. Good. Alright, opposite side. Good work. Alright, I didn't mention this much before, but I am going to do just a quick test on your ears. Going to make a soft noise by each ear, and I just want you to tell me which ear I'm making the noise in. Okay? Good. Good. I should probably mention you should close your eyes. Yeah, you had them closed anyway. Good. Good. Yep. I was trying to trick you there. I did them both at the same time. just going to write down some of the major findings in your handwritten file. And that way, when I send you up to make your next appointment, they'll know exactly which department to send you to, okay? I want to thank you so much for being such a kind patient. Oh, it's no problem. Okay. I'm just gonna be honest. If Imitrex isn't working and you're still in pain, I honestly don't know what else that I should prescribe to you. I don't necessarily want to prescribe anything more powerful, because at this point, we don't know what's wrong, and I could accidentally prescribe something to you that could make it worse. Honestly, I don't know. I don't know what the problem is yet. I know we found a little something in the back of one of your eyes. One of your eyes had some lagging issues, and we're gonna check those things out closer, and hopefully they'll be able to tell you what the problem is, okay? Alright. Right. Good. Okay. I am going to give you a copy of everything that I wrote down, and you can take that to the secretary at the counter, and she'll set you up with your next appointment. Here you go. Alright. Yeah, you are good to go. Yeah, if you would like to make a follow-up appointment with me, that is just fine. Just make sure that it's after you've done your other appointments, okay? Right. Yeah, I can help discuss the findings with you. It's not a problem at all. Right, thank you very much. I hope I get to see you again. Okay. Bye. Have a good day.